Location, bladder 17 is 1.5 June lateral to the posterior midline on the level of the lower border of the spinous process of the 7th thoracic vertebra, T7. How to find the spinous process of T7 is approximately on the level of the inferior angle of the scapula. Bladder 17 is located on the level of the lower border of its spinous process and 1.5 June lateral to the midline at the highest point of the paraspinal musculature. Or use the spinous process of T3 for reference, generally on the level of the medial end of the scapular spine. Or use C7 as a reference point. Located on the same level are DO9 on the midline, a point of EXB2, 0.5 June lateral to the midline, and bladder 46, 3 June lateral to the midline. Bladder 17, needling, 0.5 to 1 June obliquely towards the spine. In clinical practice, this point is often needled transversely, subcutaneously towards the spine. This allows the patient to lie in a supine position during needle retention. The needles can be secured with tape. Caution, pneumothorax. For the action indication, bladder 17 cools blood heat, stops bleeding, removes blood stasis, nourishes and harmonizes the blood and yin. It also regulates the diaphragm, descends counterflow qi, moves qi locally and along the channel pathway. For the special features, bladder 17 is the Back-Shu point of the diaphragm, meeting point of the blood. Bladder 17 is an important point with many functions. First of all, it has a multifaceted effect on blood as it can invigorate, cool, and nourish blood and stop bleeding. Its primary function is to invigorate blood and stop bleeding. An interesting passage in the explanation of acupuncture points correlates the multiple function of this point in relation to blood to its location in between bladder 15 and bladder 18, bladder 17, bladder 15, bladder 18. The heart generates blood and the liver stores blood, hence this point affects blood. Firstly, bladder 17 invigorates blood, that is, removes stasis of blood from any organ, but only if needled, no moxa, with either reducing or even method. It is used as a general point to remove stasis of blood in any organ and from any part of the body, but especially the upper part. It can be combined with the back transporting points to eliminate stasis of blood of the relevant organs. For example, combined with bladder 18, it removes stasis of liver blood, while combined with bladder 15, it removes stasis of heart blood. As bladder 17 invigorates blood, especially in the upper part, and spleen 10 in the lower part of the body, these 2 points are frequently combined to invigorate blood and eliminate stasis in any part of the body. Clinical note, as bladder 17 invigorates blood, especially in the upper part, and spleen 10 in the lower part of the body, these 2 points are frequently combined to invigorate blood and eliminate stasis in any part of the body. Secondly, bladder 17 cools blood and stops bleeding, but primarily bleeding upwards. That is coughing of blood, vomiting of blood, and epistaxis. This action in stopping bleeding upward is also connected to its action in subduing rebellious qi, a pathology that is often present in bleeding upward. Thirdly, although the ancient texts seldom stress this function, bladder 17 can nourish blood if used with direct moxibustion. It is therefore used for deficiency of blood of any organ. It is usually combined with the back transporting points to nourish the blood of the relevant organs. For example, it is combined with bladder 18 to nourish liver blood, with bladder 15 to nourish heart blood, and with bladder 20 to promote the spleen function of producing blood. Fourthly, bladder 17 moves qi in the diaphragm and chest and is used for feeling of oppression and pain of the chest and fullness in the epigastrium. Fifthly, bladder 17 pacifies stomach qi and it subdues rebellious stomach qi. which is stomach chi going upward instead of downward. It therefore treats such symptoms as hiccup, belching, nausea, and vomiting. Sixthly, bladder 17 has a general tonification effect on all chi and blood of the whole body, infused with direct moxibustion. To this effect, it is usually combined with bladder 19, and the combination of these 2 points is called the 4 flowers. Another combination to tonify chi and blood in general is with bladder 18 and bladder 20 with direct moxibustion. This combination is called the Magnificent Six, counting each point bilaterally. For the summary, it invigorates blood with those having heart pain, stabbing chest pain, pulls blood, stops bleeding, those coughing with blood, vomiting of blood, and nosebleed, and it nourishes blood with using direct moxa. Opens the chest and diaphragm, subdues rebellious chi, those having epigastric pain, vomiting, hiccup, difficult digestion, sour regurgitation. It also benefits the sinews, those having painful obstruction syndrome, B syndrome of the whole body, pain in the whole body, swelling, distension, and pain of the body. It also tonifies chi and blood with bladder 9, used with bladder 19.